Welcome to Chat with Dr. Kat. I'm Dr. Kat. Welcome, welcome, welcome. Today, we are going to be talking about menopause. Now, I just want to get this straight that we're going to be talking about a few things with menopause, but I'd also like to give you some referrals to one in particular, a great group of people that I think is amazing that gives you a lot of valuable information. Now, here we go. Menopause. Why is it so difficult for women? Why is it difficult for the people that they are in relationships with? And we're going to talk about that. Remember, no fluff, no judgment, just real talk that leads to real change. Please continue to send in your requests, your thoughts, everything at chatwithdrkat.com. If you want to be a guest on the show, you have valuable information, or just want to talk, let me know. Would love to have you. Keep bringing in information. So let's talk about menopause. It's a difficult thing, women's health is really not where it should be. We talk about it improving and advancing and all of that. There's a lot of things going around, in our nation, in our world, that really does bring down women's health. Women still struggle. I'm going to share a story of my own journey that I had in reaching out to a doctor. And I was shocked. I was really shocked. I was really shocked about the feedback I received. And I decided to call him on it because I thought it was important. And I'm going to share that with you in a little bit. Here's the thing. Now, why do we look at it from a relationship standpoint? Women go through a lot in general. We start our periods at very young age. Lot of years before we even decide to have children. And I'm not talking about the oopsies and somebody gets pregnant young and things like that. Okay, all of that happens. But for most women, you have your period at a young age. We endure a lot of discomfort, pain, all of that monthly. So we start getting used to feeling pain and discomfort. That's why a lot of times, you'll see women that they'll say, wow, why haven't you gone in? I thought it would go away, or I didn't realize it had hurt so bad. And it's just because women do have a very high threshold for pain, just because we are in it every single month. Okay. Then women get to the point where some choose to have children, some don't. Either by choice or infertility, or there's a bunch of issues. Now, with all of that, again, pain, emotional discomfort, all of that. Now you have women who decide to have babies. Your body is taken over by this beautiful baby. I remember at one point, my intestines were kind of like gurgling, but they were over to the side. So my intestines had already been pushed over, and I felt it on this side. Like everything gets shifted in our body. When we talk about postpartum depression, which will be on another segment, that can set in a year and a half after the baby is born. I'm not sure most people realize that postpartum depression can set in 1.5 years after that baby is born. Sometimes people are, they have depression, anxiety before, they have all these things going on. Sometimes they can get exacerbated when you're pregnant, when you're not, with your period. Now, when you think about it, we step back and we look at it. A woman's cycle, we usually have one really good week. The rest is leading up to the period, and coming back down from the period. So we have our emotions fluctuating, all of that going on. Now you start making your way into menopause. You have early menopause, perimenopause, you have menopause, postmenopause, you have all of these different things. Now, most of the time, women just keep trudging along because now they have kids maybe that are older, teenagers, and they are feeling uncomfortable. I was at this one function and I quote this woman a lot. She was hysterical. And she said, so one of the side effects that I've noticed is weight gain. She said, I swallow my own saliva and I gain about 5 pounds. Why is that? Anyway, it was just funny because we go through that. Your body is shifting and changing. There's things that you were able to do easily before that you're no longer able to do. Some women have night sweats and hot flashes and all of that. I remember I was giving a conference and I don't know, it was probably a couple hundred people, and I was talking about telehealth. I'm one of the founders of telehealth. So I was talking about telehealth and how it worked and different ways to incorporate it into your practice and things like that. And I remember looking over and there was a woman who was sitting next to the thermometer, right? The thermostat. About 45 minutes in, I said, so my bottom jaw started to just quiver. And I said, I am so sorry, but I am freezing in here. Is there any way? I said, I know I see you. And she stands up and she goes, I am so sorry. I am just hot all the time. And I said, women, how many of you are hot in here? And it was so many women raised their hand. And I said, you know what? Give me a minute. I brought a sweater. I'm going to put it on. But if my jaw keeps quivering, forgive me. Everybody laughed and, we went on with it. But one of the reasons why I did that is because I didn't want them to change for me. I wanted them to know, I hear you. I get it. I can put on a sweater and hopefully I'm good to go. I wanted to show empathy because I knew eventually I was going to be there. Okay. So this is the next phase of what I want to talk about. Husbands, if there's husbands watching or wives or partners, and you know that your significant other is going through menopause or you're going through menopause, show them this podcast. Please give them the space to go through what they're going through. A lot of times they can't explain why they're so angry. They can't explain why their fuse is short. We've always said, when you get to your 50s, mid 40s, you just don't want to take things from anybody anymore. You just, you push away friends that you don't want in your life. You can say the things that you've never been able to say. A lot of it is perimenopause. You just don't have the patience anymore. You don't have the patience. You step back and you realize who you want in your life. But a lot of that creates turmoil. Sometimes in the household, maybe you were this loving mom who was super mom and did everything. And now you just want to take a bath. Maybe you're trying to figure out what's going on with your kids and you let things go for the 50th time, but maybe now you hear something for the first time, you lose it. A lot of that is the hormones, the lack of hormones, the fluctuation in what's going on. That's why a lot of times when we look at divorce rates, we see 1 year, clearly 1 year, because either they weren't meant to be, it's too difficult to get through. 7 year, we have that 7-year itch. There's a big factor that goes along with that. I'm going to talk about that in another podcast too. 15 years and 25. We look at why 25. A lot of times people get to midlife and they go, oh my gosh, I can't take this anymore. A lot of times also is because women start to change. Men change as well, but women start to change. They're not as, maybe as much of a caregiver. Maybe they're not, they're changing the rules a little bit, but it's because of what they're going through. Be patient. Be patient. They've spent years with a period, having children, having their bodies take up to 3 years to recuperate from having a child. You still can't exercise maybe sometimes without peeing on yourself a little bit, or sneezing or coughing or some of these things, right? Be patient. They've been through a lot to provide a home, a family, this wonderful environment. Now they're going through it. A lot of times, moms or women are not given that space because women tend to be more nurturers. And now they're no longer feeling the need to be a nurturer. And so no one knows what to do with it. So they become angry and they become defensive when really that's when you step in. You know, if you're having a hot flash during the night and your partner is saying, my gosh, it's so cold in here. What are you doing? I'm going to challenge that partner. Go get an extra sweater, put on a hat, put on something because she's suffering. She's suffering. Okay? Now I know you're quivering and you're going through that, but if there's something you could do to give back to her because she's had the periods, she's had the babies, now she's going through this change. The other part of it is sometimes women, we've hated our period. We didn't like it. We didn't like dealing with it. Now that it's going away, we want to hold on to it. Why? Because it's telling us maybe we're coming to a certain age. Now it's telling us we can't have babies anymore, even though we don't want babies anymore. But we can't have them. We don't have a choice anymore. A lot of that is hard to deal with. Please have the patience. Now, I'm going to tell you my story, and then I'm going to give you a resource that I think is amazing. It's a group that has started that's building and is just absolutely amazing with a tremendous amount of resources on it. It's called Mama in Menopause. It's fantastic. Mamas in Menopause. There's an Instagram group, a Facebook group that you can join. Facebook is great. There's, different talks on it. There's different things that you can go to. Now, that's locally in the San Fernando Valley. But if you're not around and not in that area, you can still benefit from going on. This wonderful woman, Meredith, a friend of mine, started it. And she's great. She has amazing energy and she's doing a lot of wonderful things. So I'd really like to shout out to her and, congratulate you for doing something amazing for women. So here's my story. Okay. So I have my normal doctor that I go to who is amazing. Linda is amazing. Okay. So I started noticing changes and I wanted to, get ahead of it, and then I ignored it. And then I noticed some things and then I ignored it. Then I felt discomfort and I ignored it. Oftentimes this is what women do. And I remember I started having these itchy ears. I wasn't experiencing, hot flashes or night sweats or any of these other different things. I had a few other ones, joint pain, but the biggest thing, oh my gosh, was this itchy ear. And I thought, what is this? Went to a dermatologist. They said, well, there's nothing there. I mean, I can see it a little irritated from you itching. Nothing. Went to my regular doctor. Nothing. One day, I started really looking into kind of expanding my practice into, changing for women's health and getting more focused on that. I do a lot with pregnant women, couples, and all of that. But now with this change, I wanted to really start focusing on that. Guess what was a side effect? A symptom, itchy ears. Couldn't believe it. I had gone to doctors. No one told me. No one said anything. I don't think they knew. Okay? This is what I mean by women's health not being where it's supposed to be. We must learn how to be our own advocates. Now, Meredith had me on Mamas in Menopause, and I talked about this very story, and I want to bring it to you. So Linda, my fabulous doctor, my gynecologist, was out of town, and she was going to be out of town for a bit. And I thought, you know what? I want to get some blood tests. I'm going to be an advocate for myself. I want to see where my hormone levels are. I also get my thyroid checked all the time. All of those different things. So I figure I'm going to go in on a Zoom. I'm going to go on the Zoom. I'm an expert in telehealth. I'm comfortable with it. Plus, I only like Linda when it has anything to do with a physical exam. So I went with my comfort level. Anyway, this gentleman comes on, this doctor, very young doctor. And I start to tell him certain things. And he goes, I was like, what? He goes, I don't know. Those sounds like maybe they're individual symptoms of things, disturbance in sleep, itchy ears, physical body changes, different things. And I thought, actually, they're all about menopause, perimenopause, and postmenopause, and anything menopause. These are classic symptoms. And now he's telling me that it's probably in my head, or that I should go figure out with a sleep doctor. I should go figure out with a dermatologist for the itchy ear, body changes. I should go to this person. I should go to this person. And I said, you don't think any of those things are like perimenopause and menopause and all that? He goes, it could be. And then I said, well, I'd like to get my hormones checked. He goes, do you really feel you need to? And I said, yes, I do. Then I said to him, what about the medication, hormone replacement? I said, I've been doing a lot of research. He goes, oh, well, it damages the heart. He started spewing out all of this old information. Now, he was a young doctor. Finally, he's like rattling off stuff. Now I'm paraphrasing it a little bit, but I said, stop. I said, please, stop. And he looked at me and he goes, excuse me? And I said, you need to stop. I said, you need to do better. I said, I'm a person who's listening to what you have to say. I already know you don't know what you're talking about. And I said, because I do research, I help women through this. I already know that you don't know what you're talking about. There's so much definitive research that the opposite of what you're saying is true, that if a woman depletes their body with hormones, that it can be detrimental to their heart, that old information doesn't apply. And I said, but here's the scary thing. I really felt compelled to tell him this. And I said, here's the scary thing. I'm still going to make another appointment with Linda because I really want the help. But there are going to be so many women that walk away from meeting with you that are going to think it's all in their head, and they're going to continue to suffer. Their families are going to suffer, and they're going to be uncomfortable, and they're going to feel guilt, and they're going to feel shame, and they're going to feel disappointment. There could be damage to their heart. There could be damage to all these things because you didn't have the information. And I'm kind of feeling like you're shaming me. And he's like, oh, what? And I said, it's okay. I'm just giving you this feedback because you need to do better. You need to do better. But this is over. We're done. He turned it around and said, I'm going to order this test, this test, this test, this test. And then what I'm going to do is I'm going to order the hormone replacement for you. And I said, stop. Now you're doing the far extreme. We don't even know if I need hormones at this point. I need the test first, then I need a conversation. I need to look at options. I said, now you're going to the other extreme because I've put you in your place. I said, it's okay. I just need you to know you need to do better. Now, I felt compelled to say this to him because I want women's health to be better. And I'm not saying everybody needs to go out and be hypervigilant and say this. And I'm paraphrasing. I was very kind, but I was very bold and I was very strong. And I wanted him to know that no other woman should be hearing this information. No other woman should walk away thinking that they have to suffer. So, if you go to a doctor, a gynecologist, they don't say the right information. And how do you know it's the right information? Research it. I'm not saying you become your own doctor. Research it. Go onto Google. Listen to different podcasts. Go to Mamas in Menopause. Go to different groups out there. Find out information. Go with an arsenal of information, prepared to be in charge of your health, while also listening to your doctors. Okay? But if you go to that first doctor and they don't have the knowledge, oh my gosh, move to another one. There's so many doctors. I even say that about, psychologists. If you don't connect with me, there's thousands of us. You need to feel a connection. You're going to be telling me your innermost thoughts, secrets, feelings. You need to feel trust. You need to feel that things are moving along, that you have something that you're working on, that you know I'm your person. It's the same thing with women's health. Find someone you connect with, that you feel good about, that you feel they're listening. You know, when I booked my next appointment with Linda and we started talking about things, one of the funniest things, my husband's going to hear this too, but the one thing she said to me, she goes, so how many days a week do you feel like in the morning when you wake up, you're like deciding, should I harm him today or should I love him today? And I laughed and I said, no, I know it's a fluctuating in the hormones. You do. You wake up and you think, can I endure my family today? Do I want to escape? Do I want to run away? Or do I want to love them and embrace them? That's the fluctuation of hormones. They don't know what to do with it. Have a conversation with your family. Literally, sit down at the table. First, talk to your partner and say, hey, I'm going through this, right? I'm going through this. This is what we can expect. This is what I need from you. Take the time, plan. Sometimes we plan for finances, we plan for trips, we plan for holidays, we plan our meals, but we're not planning to get us through health issues in the right way. And with women, this is women's health. And here's the thing. We all know women are going to go through it. There's no woman that doesn't go through it. None. Even a woman who has a hysterectomy, we call that a forced, imposed menopause because they don't have the internal organs, female organs, to maintain their hormones. Take the time. Sit down with your family. Prepare your partners for what you're going through. Prepare your children. And encourage them and only ask them to use it as a tool, not a weapon, a tool to work through what's going on. Take care of yourself. Seek other women that you can speak to about this. Speak to partners who can back you up. As women, we do not need to suffer. We do not need to go through it. Again, we're used to pain. We're used to pain. Periods for years, every month could be excruciating. Childbirth, we're used to that, okay? We're used to those things. We're used to the emotional discomfort of what we go through. So oftentimes we struggle and we maintain pain longer than we need to. So speak to your families. Speak to your partners, speak to your friends, speak to other women, find doctors. Doesn't have to necessarily be a female doctor, but find a doctor who knows menopause, perimenopause, the beginning stages of menopause, postmenopause. Find someone who knows what they're doing. Go in with an arsenal of information. Become part of communities. Again, I highly recommend Mamas in Menopause. Meredith has done a great job forming this group. I highly recommend it. Facebook group, go find it, join, reap the benefits. It's wonderful. So, remember, no fluff, no judgment, just real talk that leads to real change. Go to chatwithdrkat.com. Please keep putting in what you want to hear. We will be doing further discussions about menopause, about life, but more importantly about relationships, about parenting, our relationship to our families, to our significant others, to our coworkers, to being in the wild, to being in our environment, in our communities, and our world. Remember to be kind, be patient, think of other people, choose to be better. Have a great day.